I'm Jennifer Bebee. I'm an audiologist with Western Colorado Hearing Clinic, and I'm also the owner of Western Colorado Hearing Clinic. We're located mostly in Grand Junction, Colorado, but we have offices in Montrose, Gunnison, and also Glenwood Springs. We started Western Colorado Hearing Clinic in 2012. Just contracting my services out with a local ear, nose, throat surgeon, and later I bought Gunnison Hearing Center, and I opened Western Colorado Hearing Clinic that following year in Grand Junction. I wanted to open an audiology clinic that offered better services and better care than what I had been seeing in our area and generally with the field. Audiology has the impact on communities to make an improvement for so many people, but it has to be done in a certain way, and I wanted to be able to offer that to the people in our community, and so that's why I started my company. I think one of the things that I'm most proud of for Western Colorado Hearing Clinic is our staff. I think our staff all genuinely care about the patient and their well-being, and they are all striving to grow themselves so that they can be better for our patients, and they're all having fun, enjoying that time with patients and with each other. And I think that really good culture and that good environment trickles down to patient care. And I think it's something you can feel when you come to our offices. You can feel it, and you can know that all of our staff care and they take pride in their work. And that's probably the thing I'm most proud of with Western Colorado Hearing Clinic, is that we've just got a really good team who are all trying to improve lives through the work that they do. In some offices, and I would say this is the majority, in some offices you will find that the testing is done simply to find out if a person needs hearing aids or not. In our office, we want to really understand the patient as a whole. So we're doing testing to understand what type of difficulties they're having. We're looking at cognition, we're looking at auditory performance and background noise, we're looking at things on a cellular level. We're trying to create a picture of understanding so we can conceptualize what is happening for the patient, convey that back to the patient, and help them come up with a treatment plan that's going to work for them for the rest of their lives. We're really trying to aim to improve how they live. We do extra testing because we want to verify that we get a whole picture of the patient. If you don't have an idea of a patient's cognitive abilities and you skip that step and you go straight to recommending a treatment option without verifying the patient is able to engage in that treatment option, you've missed a big part of what they need. And also, I believe that audiologists are a great avenue for referrals to other professionals who may be able to help that patient. So I'm asking questions about balance because I want to know, is somebody in need of a referral because they're slowly declining in their physical ability? That's not good for anyone. So I'll make referrals based on the conversations we're having about balance. Same thing for cognition. We're looking at the patient as a whole. I'm trying to make it so that these patients are taken care of because we're spending a lot of time with them, much more time than they're going to spend with their primary care physician. And if we can make recommendations for them that's looking at the patient as a whole, we can have more impact. So we offer psychology services related to hearing loss, tinnitus, and sound sensitivity. part of the reason that that is an offering is because our brains treat sound differently than they do some of the rest of our peripheral input, and we need a person who knows the brain very well to help us with some of the struggles that patients go through. So for someone who's truly having a difficult time with tinnitus or sound sensitivity, or even, you know, grappling with their own hearing loss or a spouse's hearing loss, there's only so much an audiologist can do. We're very functional in the way of let's help you hear better, but when it comes to understanding the brain, we have a limit. And so having psychological services where somebody's trained in the brain and understands tinnitus and sound sensitivity and hearing loss and understands how a patient would feel trying to deal with those things, and helping them to see themselves differently and to see their situation differently in a way that allows them to have better function and better mood. That's a really big win for our patients, because we get a lot of folks who come in and they've been 4 or 5 different places, they're struggling, they're not getting the help they need, they're being told there's nothing that can be done, and I don't believe in that. I think that we can do more. We just have to sometimes look outside ourselves. Okay, if you want to seek our services, you can find us online at WCHearingClinic.com. We're also, you can just type in Western Colorado Hearing Clinic. We'll show up on your search, Google, lots of good Google reviews from our Google review page. You can call us too at 970-549-4660. You can also text us at that number. We do texting as well.